Joining us live right now, Dr. Joe Congeni, Sports Medicine Center at Akron Children's Hospital. And Joe, what do you have for us today?
Hey, Ray. How you doing this morning?
I'm doing well, my friend.
Getting around town is tough. Thanks for navigating everybody as you normally do and getting them in the right spots, but it seems like it's calming down a little bit now.
Yeah, a little bit, but this snow's going to stay with us till this afternoon. So, still some areas. Not as heavy as it was about an hour ago, though.
Wow. Well, Ray, one of the things that's really troubling to me, and we've been seeing it nationally and locally with athletes, and a lot of people may think this isn't a direct sports medicine issue, but I think it is if you work with sports teams and young people, is this issue of the high rate of suicide that we're seeing. And, a lot of people are thinking, is this really touching the sports medicine world? I thought that 6 or 12 months ago, but one of the high-profile cases, of course, was the quarterback from Washington State, Tyler Hilinski, who committed suicide on January 16th. And then, of course, all the local cases that we've had here, several of which were athletes. And one of the things that children's hospitals are doing about it is, and we're doing it at Children's, and I wasn't quite sure about this 6 months ago or a year ago, we have a depression screen that we do on all teenagers. It's called the PHQ-9, 9 questions that we ask. And I thought, well, geez, for the most part in my clinic, these are pretty well-adjusted kids. And, oh, my gosh, it's really been an eye-opener for me, Ray, to see a lot of our teenage kids are very depressed. A lot of our kids, a handful of our kids even have thought about suicide. Ray, since we instituted this project at Akron Children's, several other children's hospitals are doing it too. We've had 2 or 3 kids come in that already had plans for harming themselves or killing themselves with suicide in our sport medicine clinic. So it's been a really, really a big eye-opener for me. And when you work with sports teams, you do see that there are a lot of pressures and depression and anxiety. One of the things the NCAA is studying, I was at a meeting last week, is the very, very high rate of sleep disorders in athletes and young people overall. Upwards of over 30% of our young people, and particularly our athletes, over 30%, Ray, a third, have sleep disorders. And sleep disorders are directly affecting people's performance of playing on the field. Our injury rate is related to sleep disorders. And, of course, in this area of suicide or people wanting to hurt themselves, that sleep disorder number is very high. And a lot of people scurrying around with our young people, we're trying to figure out what is it. Is it the hyperstimulation of, always being around with social media issues that's contributing to this a little bit? Is it the pressures of being in sport these days, the pressures just overall of everybody knowing every move you make because of some of the social media issues? But there's no question that we're seeing in our clinic, and again, as a guy like me who's been around a long time, I was taken aback because I just wasn't so sure a year or 2 ago when we started the depression screen. But I'm telling you that when we look at the numbers, there are an awful lot of kids and good kids and athletic kids, athletes, who are quite a bit depressed, and we have to make referrals to the appropriate authorities and counselors and others in town because of our concern about that.
Yeah, that was my follow-up question there, Joe. When you do get, the conversation with these young athletes, where do you go as a doctor from that point?
Well, I'm just so fortunate to be at an institution like Akron Children's, where we have a whole team of psychologists, psychiatrists that are really helpful and useful to us. But even further than that, in our sports medicine team, our orthopedists, like Dr. Jones, our chairman, and Courtney Meyer, our rehab person, they're seeing it in their clinics so much, too, that we've just gone about getting set here to hire our own sports psychologist because we have enough of issues, and our issues are unique enough in the sports world that we really feel we need a sports psychologist. So we've been working with one the last year in the community, but we're just going ahead now, and we're going to hire our own at Akron Children's. So not every case, of course, needs to go to the sports psychologist. We'd overload that person, but we have a really good, strong team But if we get to the point where, as a part of this depression screen, people are having issues with depression and anxiety, we'll make an appropriate referral. But if they check off that they really have a plan or they're thinking about suicide, we don't let them out of our office. I mean, we have a team at Children's called the Perk Center, and we get them down within the emergency room to this immediate care place where we have some psychologists that are ready to meet with these kids at that time. And again, like I told you, Ray, we've had a couple in the last couple of months, and more than a couple that have had a lot of depression screening as a part of this. So it's not just a part of all just teenagers and other issues. It's clearly a part of our sports medicine world, and it's got me a little bit surprised and a little bit hard to figure it out because, I'm pretty embedded in the sports world. I'm with high school athletes a lot, and a lot of times we see the joys and the fun parts of it. But there's a real lot of pressure on kids, and that one issue of sleep, that's a big one. That has really been something that I think has changed a lot in the last 10 years of athletes.
Yeah, good stuff. Joe, well, listen, thank you for the insight into that type of sports medicine center and certainly talking with the young athletes. We appreciate it. Take care, my friend. We'll catch up with you next week.
Thanks, Ray. Have a great week. See you.
You too. Dr. Joe Congeni, Sports Medicine Center at Akron Children's Hospital.